cancer. Now, in my first episode, I talked about metabolism. What I didn't mention is that you could split metabolism into two general categories of processes, all right? One would be called anabolic processes or anabolism, and the other one would be catabolic processes or catabolism. With anabolic processes, what we're talking about is building up tissue to store energy in them. That's really anabolism. And when we talk about catabolic processes, we're talking about breaking down tissue to release energy, all right, to release nutrients. So we have anabolic processes, we have catabolic processes. Anabolism is to build tissue, so we store the energy in that tissue. And catabolism would be to break down tissue and release energy from that tissue. What we're really concerned about would be the net of those two, because you will have both processes occurring in your body at any given time. It's not like you only do anabolism or you only do catabolism. At any point in time, you have both processes going on, and we're looking at the net effect. We're also looking at, specific tissues. So, for example, you could have a net anabolic effect in fat tissue. So you're building up more fat tissue, and a catabolic net effect in muscle tissue, and you're actually breaking down muscle tissue. So again, because we are talking about muscle, let's just have that context. We're talking about muscle here when we're talking about anabolic or catabolic processes, okay? Now, because I told you how important it is to have muscle, it is metabolically very important, then obviously we want more anabolism with regard to muscle, which means we want to build more muscle tissue to preserve what we have, or hopefully even gain a little more muscle tissue, right? So we hope to be anabolic in terms of muscle. Over the course of our lifetime, though, from the time of your 40s onwards, unfortunately, the natural process is to start losing muscle. You lose about 3 to 8% of your muscle mass over the course of a decade from the time of your 40s onwards. All right? That's what the textbooks say. Yeah. Yeah, no, reality, it's probably worse than that. Okay? So, even if you're doing the right things, even if you are having good nutrition and trying to exercise and do all the right things, you're still going to have this tendency to lose muscle. And so, you still have this tendency to lose that 3 to 8% over the course of the decade. This is what we call anabolic resistance, because you are resistant to anabolism in muscle. You're resistant to building up muscle as you age, okay? Anabolic resistance. Now, I told you from the time you are in your 40s and onwards is when you start to see this anabolic resistance. But in reality, what I'm seeing is people in their 30s onwards start to become resistant, all right? And this is especially true because I see people who work a lot in sedentary jobs. They're not moving very much. So the more sedentary you are, the less active you are, the more you're going to have this anabolic resistance. So I tend to see it at an earlier age. On top of that, if you have chronic diseases, that's going to also accelerate this anabolic resistance. And we'll dive into that a little bit later. All right. So if you are sedentary, you're not very active, you have chronic diseases, that's not good. You're going to have a little bit more of this muscle loss, and it will start earlier. In addition, in real life, we have catabolic crises, right? And what this means is we have periods in our lives where we actually have more catabolism going on. For example, if you get an infection or you have surgery. So take the case of infection. If you caught pneumonia, right? So you're not feeling well, you're in bed, you need energy to fight the pneumonia, and maybe your appetite is down as well. So that would be considered a catabolic crisis. If you had surgery, for example, even pre-surgery, you might already not be as active because you're not feeling well, or you're not able to move as well because of pain. So pre-surgery, you're already starting to be more and more inactive or sedentary. And then you have surgery, right? And that itself is a major catabolic crisis because, surgery usually involves cutting you open, right? And then you have those wounds and they need to heal. And you also immobilize, you have bed rest. Maybe you're not able to be full weight bearing. And, your doctor may say no normal activities for, several weeks. So when we think about surgery, you always realize that those are catabolic crises. So when we factor in these catabolic crises, in the normal course of life, then instead of that 3 to 8% muscle loss over a decade, probably we're looking at 5 to 12%, and in some cases, maybe even 15% muscle loss over that decade, each decade, okay? And probably gets worse as you get older, right? So rather than 3 to 8%, I think in reality, it's probably 5 to 12, maybe even 15%, especially in people with chronic diseases as well. Now, I talked about infection and I talked about surgery, hip replacement, maybe you have hernia surgery, that kind of thing. But there's one other case of catabolic crises that I want to bring our attention to. And I call it a covert catabolic crisis because we don't recognize it. It's right in front of our eyes and we don't really think about it, right? And this would be weight loss. Weight loss, yes, can be, usually is, a catabolic crisis. All right. Now, obviously, we have high prevalence of obesity in our population today. By BMI, I told you, 42 to 45%, somewhere in there. But if we go by percent body fat, then we're closer to 90% obesity in the population, right, in the U.S. So at any point in time, I can tell you that there are many, many millions of people who are trying to lose weight. And they put themselves on these diets, they try different things. But what we're not considering is that when you do that, you are essentially putting your body through a catabolic crisis. So let me give you an example. If you take someone who has lost 60 pounds, all right, let's say this person, found a diet that worked for him and he focused and, was very determined and lost 60 pounds. Well, that's the good news, I think. The bad news is that with weight loss, up to 35% of that weight loss is from fat-free mass. 35%. Okay. So that's about, in the 60-pound weight loss, that's like 20-something pounds. Right? A little bit over 20 pounds. Now, some of that is water, because that is part of fat-free mass, but also a good amount is from muscle. Okay? So we are losing muscle when we lose weight. So because we've lost muscle, then your basal metabolic rate drops and you have less metabolically active tissue in your body, right? Now it's harder to maintain that lower weight. And so inevitably people will regain the weight. But here's the really bad news. You're not going to be regaining muscle because of anabolic resistance. Most likely, the majority of the weight regain is going to be from fat. So now your body composition shifts even further, right? You lost muscle. Now you regain even more fat, which is also damaging to muscle, and we start this vicious cycle. I see this often in a lot of the women who come to see me, and many of them have just tried every single diet out there. And they will come and tell me, Dr. Loh, I hardly eat. And that's very common. They actually go into this restrictive pattern. They don't eat. And yet I keep gaining weight, or I can't lose any weight. There's just something wrong. And my doctor keeps telling me I should just eat less, I should eat healthier, but I'm not eating, I promise, right? And I believe them. Okay? We stereotype a lot. We make all kinds of assumptions around weight and obesity. And a lot of these patients will come and they'll say, I hardly eat and I'm unable to, lose weight or to maintain my weight. It just keeps going up. And a lot of the times, every time they try a new diet, they're losing more lean mass, they're losing more muscle, and they're negatively impacting their body composition. I want to specifically reference this article that came out in June of 21. It's a study from the Netherlands, so I don't want to mention the authors' names because I will mangle them, but I will put the reference up on the website. Anyway, it looks at magnitude and progress of lean body mass, fat-free mass, and skeletal muscle mass loss following bariatric surgery. So this is looking at bariatric surgery and how much of the weight you lose is from fat-free mass, lean body mass, or skeletal muscle mass, right? So the average weight loss from bariatric surgery is 32% of pre-operative weight within the year of the surgery. Okay? 32%. And because I use DEXA and I mostly look at lean body mass, I just focus on the lean body mass part of this paper, although they actually also address fat-free mass and skeletal muscle mass. All right? So this was a meta-analysis, and so with the lean body mass, they looked at 37 studies. And what they found was that 12 months after bariatric surgery, the lean body mass loss was about 8.13 kilograms. That would be 17.8 pounds. So let's just say 18 pounds in the course of a year, right, after bariatric surgery. So that works out to be about 23% of the total weight loss, okay? 18 pounds of lean body mass loss. 55% of that loss occurs 3 months from the surgery, in the first 3 months. So basically, they lose something like 9.79 pounds or 10 pounds, let's just say 10 pounds, right, within the first 3 months of surgery, out of those total 18 pounds of lean mass that they've lost. Now, in comparison, if you look at a diet, a VLCD, a calorie restriction diet of 800 to 1,000 calories, in 3 months, the fat-free mass lost is 1.5 kilograms or 3.3 pounds. Okay? Now, I just want to make it clear, I am not here to speak against bariatric surgery, because I have lots of patients that I treat who have had bariatric surgery. And I think that bariatric surgery, medications, use of meal replacements, these are all good tools in helping people manage their metabolic health. All right? They are good tools. But they all usually have to be paired with behavior modification. Right? The best surgeons will tell you that. Anyone prescribing you a medication will tell you that, right? The best results are always with behavior modification, because if you don't address behavior, you're really going to see weight regain, and essentially you're going to see fat regain, because you lose lean mass, you have anabolic resistance, and then most of the thing that you regain is going to be mostly fat. So these are great tools, but you have to think very carefully when you have a patient what is happening. So I told you I have lots of patients who've had bariatric surgery, And I like working with the bariatric surgeons. Now, when they send me the patient, though, it means that I really have to think about their overall metabolic health and not just focus on how much weight they've lost. Okay? Sometimes we're happy that we get them off the diabetes medication and so forth, but that's not looking at the big picture and the long term. So you really have to be very careful what is actually being lost. You know, we could lose fat, that's good, but especially the sick fat, right? But if you're losing muscle, yeah, you're going to have to prioritize making sure they preserve as much of that muscle as possible, right? That's what's not being discussed, I think, in the general medical world, in the general obesity treatment world.